Good morning, and thank you for joining us. I'm Kim Johnson, and I serve as the Secretary of the California Health and Human Services Agency. Today's webinar will focus on vaccine access and guidance, and this is specific to California. This is the second webinar that the California Health and Human Services Agency has hosted, focused on how federal policy changes are impacting a healthy California for all. And the first, if you joined us, was focused in on the provisions and impact of HR 1. As you know, the Trump administration is making many policy and funding changes at the federal level that are having a direct impact on states across the country. In response to the federal dismantling of national disease prevention and tracking programs, the termination of life-saving funding, and the withdrawal from the global public health community, California is taking action. California will continue to lead with evidence-based and science-driven public health efforts to protect our communities and remain at the forefront of health prevention and protection. You may have heard Governor Newsom recently announced the West Coast Health Alliance to ensure public health recommendations are guided by safety, efficacy, transparency, access, and trust. The governor and the California legislature also just recently agreed on legislation focused on public health and vaccine access. This will be the focus of our conversation today. Next slide, please. I'll just note that today's topic is especially important as we are heading into the respiratory virus season, and we know many of you both want to know for yourselves and your families, your loved ones, about how to keep yourselves safe, and also those who can amplify that message to others. So we also know that you're interested in learning more about the changes that we have just made to California's law to maintain insurance coverage and ensure access to vaccines across pharmacies, clinics, and other healthcare providers. Throughout the course of today's webinar, we welcome your questions. Please, throughout the webinar, you're welcome to put those questions in the Q&A and submit those in writing. And at the end of today's webinar, we will be able to address some of those questions. So we will wait till the end to address them, but you are more than welcome to add them along the way as the presentation is happening. And again, the Q&A function is at the bottom of your screen there to submit those questions. Next slide. I am joined today by Director Pan and Director Watanabe, who will provide the bulk of the information that we'll cover. I will come back on in the closing of today's webinar and also facilitate that Q&A. But again, it is my privilege to welcome a phenomenal leader for the state of California and beyond, Director Pan. Welcome.
Good morning, still morning. Thank you so much, Secretary Johnson. Let's go ahead to the next slide. So as mentioned, I'm Dr. Erica Pan. I'm your California State Public Health Officer and the Director of our Department of Public Health, and here today to give you some hopefully helpful updates on what's going on with immunizations nationally and here in California. Next slide. So wanted to start with, I know there's been a lot of questions coming in to all of us about the West Coast Health Alliance. And of course, we're really excited, as Secretary Johnson mentioned, that we have launched this alliance with Hawaii, Washington, Oregon. And really our goals with this group are to uphold scientific integrity in public health and focus on evidence-based recommendations from respected national professional organizations. Given all that's happening with the federal recommendations, we wanted to stay aligned across multiple states that are unified and continue to be unified with our integrity and these national recommendations. And we really want to coordinate together to reduce confusion and increase trust in the established recommendations that have tested over time and have evidence over time, and again, with other national medical professional organizations. So this helps us really reduce that confusion, show our stance together and our unity in what we continue to see as the appropriate recommendations and alignment. This is not intended to replicate other national groups that have done either prior or current in-depth reviews of evidence to recommendations. What has happened with the Advisory Committee on Immunization Practices is very unfortunate in that they used to have months to weeks of sub-work groups and meetings where they looked at all the evidence to review to recommendations. And that is not what this group is intending to do. We did have a with some similar overlapping states during the COVID-19 pandemic, we did have a Western State Scientific Review work group that had a lot of representatives from even those national committees and other subject matter experts. Right now, we're really focusing on state health leaders and our internal subject matter experts to look at those national recommendations, review how those recommendations have been made and make sure that we all agree, and then coming out with unity in upholding those recommendations. So it's also, of course, just the beginning, we think, of an important partnership where we'll be looking at other programmatic and implementation efforts. We, of course, have to do them a little bit differently in each state based on our own statutes. But with this idea, we have these shared principles about not only the scientific integrity, but promotion of vaccine access and coverage. So we'll be looking at multi-state, if there's need to bring our states together that work with multi-state pharmacies or other providers, et cetera. And of course, sharing tools and language as we all try to update our various regulations, et cetera, to promote vaccine access and coverage. Next slide. I thought this was a helpful way for us to know and think about where in California laws before AB 144 that was just signed, did we see ACIP, or the Advisory Committee on Immunization Practices, recommendations. So they're in a few different areas. School entry requirements are actually listed, each vaccine and each disease is listed as an individual vaccine that's required by law for schools and childcares. The medical exemptions do reference historically ACIP, AAP, and AAFP, the American Academy of Pediatrics and American Academy of Family Practitioners. And then pharmacist vaccination in the business code around scope. Currently, they in California, or prior to this as well, an MD did not need to order it, and a pharmacist could do on their own without a prescription for anyone over 3 years of age if it was authorized by the FDA and recommended by the ACIP. We know here in California and across the country, actually, the major provider of seasonal vaccines like flu and COVID-19 tend to be pharmacies. So it's a really important place of access that we want to make sure we continue to promote. And then there are a few things in specific settings and populations as far as standing orders and skilled nursing facilities for flu and pneumococcal vaccines. CalWORKs recipients need to demonstrate awareness and education on these vaccine recommendations. And then, of course, really importantly, insurance coverage, which Director Watanabe will talk about after I do. But there are some places in our law where we can stipulate how and what is covered related to vaccines. And it used to refer to the Advisory Committee on Immunization Practices. Next slide. So with this new state law that we have just signed off on, CDPH is now the source for immunizations and preventive service guidelines based on these national professional medical organizations. So it did sort of set a baseline recommendation as of January 1st, 2025 for whatever was in that ACIP schedule. And then the U.S. Preventive Services Task Force as of January 1st, 2025. And we, as a Department of Public Health, can issue updates as needed. So if there are future changes as far as FDA authorizations or ACIP changes, which I'll talk about momentarily as far as the recent ones. And then we're also concerned and looking forward, and so we did this preventively as well, to have a way that if there were changes in the U.S. Preventive Services Task Force recommendations for important screening and prevention, that we would have a way as well to establish those recommendations here in California based on ongoing science-based and evidence-based recommendations. California regulated health plans are required to cover these immunizations and services. Again, Director Watanabe will talk more about that. And then also the new law provides liability protection to providers who administer vaccines based on these recommendations. So we essentially eliminated the ACIP from all of these areas of law and referred instead to national professional organizations and our department and our ability to be able to issue updates as needed after that January 1st date. Next slide. Also, just really specific to pharmacies, again, since a huge proportion of these seasonal vaccines especially are provided in pharmacies, we wanted to make sure that you and others know that a pharmacist can independently initiate or administer any immunization that was ACIP recommended as of January 1st and currently recommended by CDPH and to anyone 3 years of age or older. And then this aligns those coverage requirements for commercial plans. And then again, provides a pharmacist the authority to administer immunizations pursuant to a protocol with a prescriber as needed. So specifically around COVID vaccine, especially when there were concerns about the FDA authorization changing, our recommendations at CDPH to anyone who wants COVID-19 protection, the state law does not require any kind of prescription or attestation for pharmacists to administer. Next slide. And then there is some language there again about provider liability protection. So persons prescribing, dispensing, ordering, furnishing, or administering vaccines shall not be liable for any injury, including residual effects of the vaccine, if they're given in accordance with our CDPH recommendations and as part of a public health outreach program. That particular update will sunset in 2030. But given sort of concerns nationally around the vaccine injury compensation program and others, this was another update that was made to this law. Next slide. So what are our current recommendations for the winter respiratory viruses? So we aligned with our West Coast Health Alliance partners in Hawaii, Washington, and Oregon on these recommendations for COVID-19, flu, and RSV. This table is available on our website, and we will continue to update other vaccine recommendations over time if they're needed, especially if there's any updates from that January 1st, 2025 Advisory Committee on Immunization Practices. And here mostly to highlight the biggest questions I think were around COVID-19 when the FDA changed their authorizations. But we do really highlight here that both for children, all pregnant women and adults, that in addition to those who are at highest risks, which are outlined in the top bullets, that all who choose protection, we do recommend have access and have coverage for those. And so that is what is now required based on this list for AB 144. I'm not going to go in details about the actual recommendations, but if there are a lot of questions, we can certainly talk more about them in the Q&A. And again, to just also highlight, these are not only aligned with the West Coast Health Alliance, but very importantly aligned with the American Academy of Pediatrics, the American College of Obstetrics and Gynecologists, and the American Academy of Family Practice. So really, again, pointing to national organizations, we're not trying to create unique West Coast recommendations. We want to align with the organizations we still do trust. Next slide. So what happened this last week? There was a meeting on Thursday and Friday of the Advisory Committee on Immunization Practices. Again, there's a lot of concerns based on who's on that committee now, their lack of having that evidence to recommendation process. So there's a lot of concerns about how they're making their recommendations. They did vote last week to remove as an option for the first dose of measles, mumps, rubella, varicella vaccine for 12 to 18 months of age. So most providers actually, probably over 80 to 90%, typically give that vaccine separately anyway, like one measles, mumps, rubella vaccine and a separate varicella vaccine at that age. But there are some parents that want to have the choice to have one injection instead of two at that age. And now what the ACIP has voted on is to remove that option for parents. So we're really concerned again that they are restricting choice as opposed to allowing for parental choice. They have not yet made any recommendations about hepatitis B, although they had a lot of discussion about deferring infant hepatitis B vaccine dose to a later age. And most recently, I think in a press conference yesterday, potentially as old as 12. So they did not vote on that. So nothing has changed there. And then for COVID-19, they actually did vote to still recommend that everyone 6 months of age and older with shared clinical decision-making is recommended by the ACIP. So this is actually broader than the previous FDA recommendations for these vaccines. They did vote because of these votes. The part that we cannot change within California is the Vaccines for Children program. How this will get implemented within the Vaccines for Children program, I think, is still to be seen. They certainly will still provide MMR vaccine for the 4 to 5-year-old dose, and how and when and if they're trying to enforce whether it's ever used for the first dose, I think is still to be determined. Next slide. And then this, I just wanted to highlight how low our vaccination rates are even before all of this, because I'm really hoping that all of you as our partners and stakeholders can really work with us together on how to better promote seasonal flu and COVID-19 vaccines, especially for those who are at highest risk. But you can see that across the board, barely, not even half of individuals nationally, and our numbers in California are very similar, get seasonal flu vaccine every year. And again, it's the best protection we have to help prevent serious illness. And as far as COVID-19 last season, only 13% of children, and then even of adults over 65 ages and older, only almost 28% actually got COVID-19 vaccine. And those individuals are at high risk for hospitalization and death. So we really want to promote access and coverage and uptake of COVID-19 vaccine. And then similarly, as far as RSV vaccine for those who are eligible, only almost half receive that as well. Although that one is definitely a newer vaccine, so I think it's taking some time for both providers and adults to get used to that new recommendation. Next slide. So how else can you stay up to date? We just wanted to, you'll get these slides and these links, but we are updating our respiratory virus surveillance dashboard that shows you kind of what's happening statewide with COVID-19, flu, and RSV. We also have our wastewater surveillance dashboard. And then CalCat is our dashboard that really looks at projections for the season. And you can look sort of a month ahead what we're seeing and thinking, based on modeling and analytics that we've developed over time, what do we think that hospitalization burden will be statewide? You can also look at that by regions on our CalCat dashboard for these different viruses. So wanted to make sure you know about that resource. Next slide. So key takeaways, AB 144 helps to ensure that our vaccine recommendations are based on expert guidance, that insurance coverage continues for the vaccines that are safe and effective, and that immunizers can continue to administer with and have liability protections. So we and along with all of you will continue to track ACIP and other federal actions. We're going to continue to partner with the West Coast Health Alliance as we anticipate ongoing changes federally, and we will update our recommendations as needed. We do have a new Public Health for All website where that table with the respiratory virus vaccine and updates will be posted. And I apologize, I didn't include that slide, but we'll make sure that gets out to all of you. And then we'll be providing other healthcare provider communications. And we have a meeting actually this afternoon with some of the key big pharmacies just to talk through this and any other implementation issues. And then we're also really excited that later this week, we're going to have our first convening of a fact coalition where we're going to discuss the facts, public health for all Californians together, and inviting private and public healthcare systems, insurers, various California medical professional organizations, our academic partners, local public health, et cetera. So we will continue to be inviting other members to join that. So if you haven't already gotten an invite, let us know, and we're happy to reach out and be very inclusive. We want to get good information out to all of our partners and make sure we're all sharing the same information and also learning more about what we're hearing from our communities about what information they need to know to make good choices or what access barriers, et cetera, they're having. Next slide. Just a few other quick resources. Stay informed. You can subscribe to our policy alerts, to our communications tools and newsletter. There's a lot of great social media tools there. If you have other questions, we have a link here for what we call our guidance and policy inquiry portal. So you can submit questions there and then follow and share us on social media and help amplify our information and messages. Next slide. So here's our handles or links for our different social media. We're very excited actually that we just now have a TikTok handle as well and presence. And we're learning again that this is where more and more people are getting their information is from social media, not the traditional media that maybe I listen to every day. So really wanting to work more on how we increase that presence. Next slide. And then some other helpful resources as far as just what we call explainers or facts as you're hearing misinformation or disinformation that you're hearing from either just your patients, your communities, your relatives. These are all great resources to look to really just find kind of the facts, where the science has been, and other resources. So wanted to share that with you. Next slide. And with that, I will conclude and I will turn it over to Director Watanabe from our Department of Managed Healthcare. Thank you so much.
Great. Thank you, Dr. Pond. Let's maybe go to the next slide there. All right. So the mission of the California Department of Managed Healthcare is to ensure health plan members have access to equitable, high quality, timely, and affordable healthcare within a stable healthcare delivery system. We accomplish this important mission by regulating health plans, enforcing California's strong consumer protection laws, and assisting health plan members. Just for some context, there are over 30 million Californians who get their healthcare coverage from a health plan that's licensed by the Department of Managed Healthcare, or DMHC. The information I'm going to cover today applies to those that get their healthcare coverage from a plan that we license or that is licensed and regulated by the California Department of Insurance. It does not apply to Medicare or for those whose coverage is considered self-insured or self-funded and regulated by the federal government. So we have some limitations on what we can do through California state law. Next slide. So you heard a lot of this already, but just to reiterate, prior to the passage of AB 144, state law required health plans licensed by the DMHC and health insurers licensed by the California Department of Insurance to cover preventive care services and items, including immunizations, with no cost sharing, or what we refer to as utilization management. I think prior authorization is the big one here. Now that AB 144 has been signed into law, we are preserving these protections regardless of changes at the federal level. AB 144 codifies the federal recommendations that were in effect on January 1st, 2025, and allows the California Department of Public Health to modify or add to the recommendations while still requiring health plans and health insurers to cover the services with no cost sharing or utilization management. Next slide. And just to reiterate, these same requirements apply to COVID-19 tests, vaccines, and treatments. Regardless of changes in the recommendations at the federal level, COVID-19 vaccines will continue to be covered without cost sharing or prior authorization based on the recommendations that were in place on January 1st, 2025, or the guidance from CDPH, as was just discussed. Next slide. In addition to all the resources that our partners at CDPH have shared, we also have a fact sheet that's called Know Your Healthcare Rights on COVID-19 tests, vaccines, and treatment. You can see the link here. These will be in the slides that are shared. That fact sheet is available in both English and Spanish. We also issued what we call an all plan letter, which is guidance to our health plans following the signing of AB 144. For anyone that wants to dig into more of the legal and technical requirements on health plans, I would refer you to our all plan letter. It really outlines the obligations of health plans to cover preventative services prior to the enactment of AB 144, but also the requirements that I just covered and you heard more about. And again, you can follow us on social media as well, or visit our website at www.dmhc.ca.gov. Next slide. And then in case you are not aware of this, we also have a help center that's available to assist health plan members with complaints against their health plans, and also just to help health plan members navigate their coverage and benefits in their healthcare system. So if you're hearing this information and you have questions about whether these changes apply to you or how to get preventative services or a COVID vaccine, you can contact our help center. So we have a phone number. It's 1-888-466-2219. You could also submit a complaint online if you're having challenges getting coverage for one of these services by, again, visiting our website at www.dmhc.ca.gov. I'll just reiterate that most people who live in California are enrolled in a health plan that's regulated by the DMHC. So our help center is a really good place to start if you're having a problem getting coverage for any of the services we talked about today. If you are not covered by a plan we regulate, we will get you to the appropriate regulator. And I will just reiterate that what we've talked about today does not apply to Medicare or for those that have what we call self-insured or self-funded coverage. And just to remind you that all services through our help center are free, and we provide assistance in all languages as well. So with that, I'm going to turn it back over to Secretary Johnson.
Thank you so much, Director Watanabe, and thank you, Dr. Pon, also for your presentation. We also, on the next slide, wanted to make sure to highlight for those who are supporting those enrolled in Medi-Cal or are participating in Medi-Cal, Again, the Medi-Cal will cover vaccines recommended by any of the following that you see on the slide. That includes ACIP, you heard earlier, the American Academy of Pediatrics, American College of OBGYNs, American Academy of Family Physicians, and the California Department of Public Health. Medi-Cal will continue to cover COVID-19 vaccinations for all people ages 6 months or older. And as you've already heard, both directors reference the vaccines for children. The VFC only covers vaccines that are ACIP recommended, but for Medi-Cal, we'll cover child vaccines outside of VFC if recommended by any of the trusted medical societies I just mentioned, or the Department of Health, inclusive of the Department of Public Health. So a California pharmacist may independently, as you heard again, I'll just reiterate, initiate and administer all immunizations that was ACIP recommended on January 1, 2025, or is currently recommended by the California Department of Public Health for persons age 3 and older. And again, Dr. Palm covered that in her slides, but really want to make sure you're underscoring for Medi-Cal. Next slide. So thank you to those who have already been sharing and lifting up some questions in the Q&A function. We encourage you to do that now, and I will facilitate with the directors a few of those now. First and foremost, the slides as well as the recording of this webinar will be made available to you, so stay tuned. If you registered, you'll receive that via email. You can also find that on the CalHHS website. So again, slides and the webinar recording will be made available to you. So I want to answer that question right out of the gate. Dr. Palm, this one's for you. There's some questions from participants related to the process the Department of Public Health will use to determine what is kind of available and accessible and evidence-based. So if you could just speak a little bit more to that, that would be great.
Sure, absolutely. I think, again, our intention is to continue to look to the national organizations that we have trusted over decades already. And I think it's important to emphasize, actually, for example, the American Academy of Pediatrics distributed childhood immunization schedules actually long before this advisory committee on immunization practices, and they're going to continue to do that. And they have quite a robust process where they pull together the evidence, subject matter experts, et cetera. So our process at CDPH will largely be looking to these other national organizations. I think the unfortunate place we're in is that it used to be a nice all-encompassing recommendation that the advisory committee on immunization practices would do for children and pregnant women and adults all in one place. And now we're having to look at separate organizations for that information. So we're certainly wanting to make sure we're in the loop and understanding how those organizations are making those recommendations. And then, of course, we're really lucky and proud to be able to work with our partners in the different West Coast states to also look with their subject matter experts, their immunization specialists as well, to look at these recommendations together.
Great, thank you. There's also a question from one of our participants today that wanted to make sure that they really understood the changes that were made to the MMRV vaccine in age groups. You referenced that. So if you would mind repeating the slide that one.
Sure. So to kind of back up in general for when a child is usually getting the MMR and/or the varicella vaccine, they typically get them at their toddler age, around 12 to 18 months, and then again right before kindergarten at 4 to 5 years of age is the second dose. So typically, most of the time, actually, most practitioners are providing the MMR vaccine and the varicella vaccine separately at the 12 to 18 month first dose, and then the combined vaccine at the kindergarten dose. So what the ACIP did was they removed the option to give the MMRV all in one. So basically one injection instead of two for a toddler at their first dose. They've removed that choice as far as what they voted on. That being said, I did see these other questions. Our understanding is there's no change in the vaccines for children having the combined MMR varicella vaccine, that sort of combined injection, because that is administered at the 4 to 5 year old age. So we're not sure operationally if that's really going to have any impact. Right now we don't see a change. It's still going to be supplied by the Vaccines for Children program.
Thank you. There's also a question from one of the participants related to children being covered that are participating at Medi-Cal. And so just to clarify there, Medi-Cal only covers vaccines for enrollees. So just want to clarify that question. in the chat too. So again, if the child is enrolled in Medi-Cal, they would be able to access the vaccines. Let's see what else we have for questions. There's some questions, maybe going back to the ways in which the Department of Public Health is making the recommendations in relationship to the West Coast Health Alliance. And so maybe talking a little bit about the relationship between how California, again, will continue and then what the actual alliance might consider.
Sure. So what we've been doing and plan to do moving forward is meet across sort of my counterparts as far as state health officers or officials to meet and convene and look at what are the national recommendations and the national evidence that's being presented. We really want to minimize confusion again, as far as, having different states do different things. So it's helpful to look together though at, just making sure that as we look again at those national professional organizations, how they're making their recommendations. And if there's some mild differences about how the messaging is happening across like adults versus children, that we're trying to align that in one place. So we're doing that both as a state, but in coordination with the West Coast Health Alliance. I want to reiterate too, because I think this is part of that question. This is a little bit different than what we did during the pandemic when we convened a much larger group with external partners, some of which were also ACIP members or the FDA Vaccine Advisory Committee members. This is really right now working across our state health officials and our internal subject matter experts to look at national recommendations. Again, we don't really want to create new recommendations. And we know a lot of those other national organizations we do still trust are doing robust evidence reviews and recommendations with the evidence that they do have. So I hope that helps clarify.
There's some questions here related to coverage. Dr. Watanabe, I'm going to direct this one to you, and that's really about the cost that people can expect, or if there's a mandatory offering of these vaccines, kind of depending on insurer. Anything you can say about potential costs for the vaccine, and or if there's a requirement to offer these vaccines that exist.
Yeah, so maybe I'll just speak to the cost. So again, for those that have their health coverage through a DMHC regulated health plan or an insurer under the Department of Insurance, there should be no cost sharing and no prior authorization. Again, I think we're again encouraging consumers and individuals to talk to their provider. I don't know that there's a mandate to offer these services or vaccines, but again, if this is something that you want access to, it should be with no cost sharing and with no prior auth. I'll just reiterate, I think there's a number of questions here again about those that have Medicare coverage, veterans benefits, self-insured or self-funded. Again, those are products that are regulated by the federal government. So we don't have the ability here in California to dictate the coverage requirements there. But again, we have, if you think there's about 40 million people in California, this applies to about 3 out of every 4. So about 30 million again that this would apply to.
Thank you. Director Pond, there are some questions related to this coalition that you referenced, the FACT coalition, and maybe again highlight and underscore the purpose. And I think the other thing that I see from participants who are asking is basically how to amplify. I know that we talked a little bit about rates of vaccination and immunizations across the state. And I think all of us, and I appreciate the partnership of participants today who are chatting and engaging in this conversation, want to make sure they have the right information to lift up. And Dr. Pond, you had a number of resources that you included, fact sheets, websites, and again, those will be made available to all of you. I also note to all the participants in your meeting invitation, you actually saw links at the very bottom of that to some of the guidance documents that both directors referenced. So maybe about not only about kind of the process by identifying who's going to be in that coalition, but also what efforts that maybe those who aren't participating in that coalition can use to amplify the message, making sure that there's consistent and accurate information to all participants.
Sure. Yes. Appreciate the question and the opportunity to talk more about this. Want to acknowledge this coalition we're both really excited about, and we're just getting started. So really want to continue to build, but the goals there are exactly as Secretary Johnson was alluding to, amplify these messages and accurate information, especially to all of our partners, and especially trusted partners who are working closer to their own communities, but really being able to provide all of you and your partners with good information. So the coalition's goals are to, yes, amplify kind of the accurate information. I think over time, we certainly are excited to potentially evolve to really looking at what are the interventions and or ways to communicate that are going to have the most impact on, for example, vaccine coverage overall. This was sort of an issue even before 2025 that we're seeing declining rates, especially in our youngest children, and a lot of inequities and disparities there. So that the goals are kind of around amplifying accurate information, strengthening our networks together to amplify that message. Some of the ways, again, are to continue to follow our website. We'll put our updated website on where our recommendations are going to be, and all of those, depending which social media channels your community uses, we'll continue to try to amplify ours. Please amplify, repost other good things you see and tidbits that are addressing some of the myths you may be hearing. And again, also, we're hoping what the coalition can help us do, and other efforts we're going to embark on, how to better listen to what people are hearing or what they want to know that will help them make good choices about their health. So those are all things we're working to do together, both with the coalition and with these kinds of webinars and other partnerships.
There's a few questions from the group here that are related to what if some of the existing bodies that you're turning to, who have researched and looked at the science, have disagreements, and how will California address that? I want to maybe give you the opportunity, Dr. Pond, to talk a little bit about how we got here. I started at the top of the call speaking to some of the federal funding and policy changes. Dr. Pond covered changes to the committees that have been designated to be the subject matter experts and evidence-based to lead these policies. And so maybe just sharing a little bit about how we are making decisions at the state level that got us to Assembly Bill 144 that was enacted, and how we'll approach, again, navigating these many changes that are happening in the bill.
Sure. I think, sort of as described, there used to be one place where all of these recommendations would be put together and with a rigorous process in that CDC schedule that was advised by the advisory committee. And now, because that has been compromised, really trying to use all the other pieces of information that had always informed those anyway, or sort of parallel processes that organizations like the American Academy of Pediatrics has continued to do, and had a vaccine schedule, again, for longer than the ACP, but has largely remained completely aligned over the last several decades, with very rare exceptions. So relying on those. I think a very important question around if there's any conflicts amongst other national professional medical organizations, that is sort of how and why we built the law, to say we will point to and refer to these national organizations that we do trust and that, don't anticipate being compromised because they're not political, they're actually medical professional organizations, and to have a way in CDPH to resolve if there are any discrepancies there. I think if and when we encounter that, I think it's where also being partnered with the West Coast Health Alliance is really helpful. And we certainly may then, in that moment, want to pull on the rich academic resources we have in California or across the West Coast Health Alliance to really look at other evidence sources to help us resolve that. We also trust hasn't really been mentioned, but I did put it, I think, on one of the resource slides. The Vaccine Integrity Project has done a really robust, systematic review of all the data for the last year or so since the last ACIP recommendations, just to see if there were any new safety signals or any new concerns that the public should be aware of, that healthcare providers should be aware of, and there was nothing there. So that's another source. But I'll just acknowledge that we are just trying to evolve with the times, and certainly look forward to any feedback or input from all of you as our stakeholders on how we best do that, and do that in a transparent and clear way.
Thank you so much. And again, I hear you saying we are following the science and the evidence, and that is what's leading the ways in which we're approaching this. I'll also just say, from a funding perspective, kind of to the point of Healthy California for All, where we've made tremendous progress together. in some places we are seeing, not only in the public health arena, but in other health and human services areas, the reduction of funding. And so I think those, again, that's why you saw in this case, Assembly Bill 144, go through the process. The legislature was engaged in it. We are thinking kind of holistically, not only about the changing policy, but then what are the other resources and mechanisms to get people access. And that's going to be a continued conversation we'll have as we move into this next budget cycle. And of course, as listeners, you're likely following the impact that the, for example, tariff policy has had on our own state budget and revenues in California, and some of the rejections that we expect with the implementation of HR 1 overall. So again, we are looking at mitigation strategies. We are not in a position to just simply backfill all of the loss of federal resources, but we are being very mindful and strategic about how we can mitigate any harm, both in the short term and long term for all Californians. So appreciate everyone's thought partnership on those fronts as well. There's a question in the chat related to those who are uninsured children in vaccine access. And so I want to say a little bit about that here. As you saw on the Medi-Cal slide, for example, there's for the VFC program, there is a need for the funding and the coverage to be associated with the ACIP recommendations. So that is still true. As we see the actions that Dr. Pond covered from the ACIP just late last week, we do believe that the ACIP has recommended COVID-19 vaccine with shared decision-making for children 6 months of age and older. So we believe that VFC will still cover the vaccine for uninsured children for COVID-19 in that space. I just want to provide some clarity for it as well. There's some conversation and questions related to local health jurisdictions and just getting some information, what conversations you might be having directly with them. Dr. Khan, anything you want to say about how you're engaging local health jurisdictions?
Sure, happy to. We have another scheduled update with our local health departments tomorrow at 4 p.m. We typically have, it's evolved anything. Right now our routine is 2 times a month. We have these calls with our health department directors and health officers to provide them updates in general, what's going on with public health. So we'll be updating them on the most recent ASAP. And of course, we have very close relationships with the organizations, the California Conference of Local Health Officers, the County Health Executives Association, and the Health Officers Association of California. So we work very closely with our local health departments and try to get information to all of you as quickly and timely as possible, and including when we can have talking points or other resources. So that's how we're updating our local health departments.
Great. And we'll go one back as we provide some information. There's a question about shared decision-making, the shared clinical decision-making. How do you understand that from the ACIP recommendation? What that means?
Sure. I think the bottom line for that, from my perspective, and we will continue to evolve if things change, but is that it doesn't change. Like for the vaccines for children, it means COVID-19 is still available in vaccines for children, and it can be administered by a provider as they would do appropriately. Shared clinical decision-making is how, when I'm a pediatrician taking care of a patient, that is what we do. We talk to our patients about the risks and benefits of whether it's a medication or a vaccine, and it is what we do every day. So it's a little bit challenging and interesting that this has been put into some of these recommendations. I think the bottom line is these vaccines are still available through the Vaccines for Children. They're still recommended by California. And we, again, as we've been sort of mentioning in all of this, we want, for example, COVID-19 to be available for anyone 6 months of age and older who wants to be vaccinated. We certainly want to emphasize the high risk, which are the very young and the very old and people with medical conditions. But we, again, want people to have access, especially if you live or work in a setting with other high risk individuals. That's an important time to get vaccinated.
Great. Thank you. We're going to leave it that with the final word this afternoon from the state's public health officer. I want to thank everyone for participating and engaging with us, and mostly also for your thought partnership. We're here in an opportunity and ability to respond to these changes, again, with the health of Californians as our priority based on our partnership across the board. So we just appreciate all of you so much for engaging with us. For thinking about our innovation and creative solutions using data and science to drive our actions as we continue our progress of a healthy California for all in California. You did hear Dr. Pond reference a few different places where you can continuously engage with us and ask questions that can be answered. So again, that will be made available in the slides. You will also again see a live recording of this webinar. Please stay tuned for our next. We have a lot going on, and we really do want to use these opportunities to engage with all of you to understand and clarify the changes that have been made to date and what California is doing as a result of the changes that we're seeing made by the Trump administration. Our commitment is steadfast here, and we are here prioritizing, again, the health of Californians across our state. So thank you again for being here this afternoon. Stay tuned for the posting of this recording and the slide deck with lots of links to obtain additional information. And again, we look forward to engaging with all of you as we move forward. Thanks so much. Take care.